I'm Carol Vanderstoop, here to talk about one of my favorite topics, ozone in dentistry. I think you'll like it too because it's one of the most exciting and versatile tools in the dental toolbox that doesn't have any downsides. I've seen many practices that were losing their vigor regenerate their enthusiasm as they institute ozone in any of its therapeutic guises into their practices. I can't believe I was in dentistry for almost 30 years before I encountered it in a meaningful way, which I guess means I just invested in it through training. So how does integrative ozone therapy fit the criteria for integrative biological dentistry? Well, a better question might be, how doesn't it? Right now I'm doing a nasal insufflation. It's the only time I can think of when it's appropriate to mouth breathe. And that's all there is to it. Of course, the nose is just a small part of the respiratory tract. Lung insufflation can be a powerful tool and often needs to be done in tandem with nasal insufflation and sometimes even ear insufflation, depending on the situation. For instance, I used all three to clear up pneumonia in about 3 days last year. And yep, you can just about guess where I picked it up. Why patients are so loyal as to come in when they're flamingly ill is beyond me. If they would just explain to the receptionist that they're worried about losing a spot on the books. Oh, please. I'd come in on a weekend to avoid pneumonia or something like that. And yes, sometimes all of us have our resistance low. I insufflate my nose and lungs fairly often. Dental personnel are known to carry an extensive and unique metagenome in their respiratory tracts due to all the aerosolized pathogens to which we're exposed daily, whether we're wearing masks or not. I mean, geez, if flushing a toilet can spew aerosolized particles more than 6 feet, what do our ultrasonics, drills, and profiangles throw? Which brings me to a story I remember hearing about 10 years ago called "Think Music Heals? Trombone Player Begs to Differ," about a musician in Connecticut who learned the hard way about the dangers of not cleaning his horn after he developed a condition that's now being called trombone player's lung. He had a horrible, deep, barking cough quite often, especially when he played the trombone, and it went on for years. The guy spent hours each day performing, practicing, and teaching the trombone, all the while struggling with health problems that made it hard to play his instrument. He had a sore throat and could lose 60 pounds at a go and often had a low-grade fever. Even though docs thought he had asthma, therapies didn't work. But at about 15 years, he went on vacation for the first time without his trombone and felt much better. He decided to check into it when he returned, and a doctor swabbed a culture from inside his horn, and you can just about guess the rest. Inside was a mold called fusarium to which he had an allergic reaction, which led to hypersensitivity pneumonitis, a severe inflammation of the lungs. Here's the take-home from that. Microscopic organisms were breaking off and getting into his lungs each time he inhaled. A year later, the story was the same, except it was about clarinets. Although it sounded like this was a new concept. Of course, if we don't learn history, we have to repeat it. This particular story on NPR was called "Take a Deep Breath, That Clarinet Could Be a Germ Factory." Now, is that striking any chords for you? Lungs pick up and culture microorganisms from the mouth that are delivered by aerosolized saliva droplets. When one has periodontal disease, salivary enzyme activity bumps up. These enzymes induce disease-causing microbes to become extra sticky. They easily colonize the throat and lungs where they continue their inflammatory destruction. We succumb to respiratory diseases when resistance is weak. Let's think for a moment about our patients with chronic bronchitis and COPD who can't easily move microorganisms from their lungs, and yet we're cleaning their teeth and making all those aerosolized particles. As long as they don't have the rare G6PD gene SNP, it would be an exceptional preventive move to have them do lung insufflation during preventive appointments, but especially during active periotherapy so that the aerosolized microbes don't have a chance to colonize there. Let's think about our patients who are using CPAPs. It's exactly the same thing as a musical instrument. Of course, I'm always checking for airway issues and screening for oral posture and sleep apnea, so I find out pretty quickly which patients are using CPAPs, and I make sure to discuss this issue with them. Sure enough, a lot of them have frequent and not so good respiratory issues. I turn them all on to SoClean 2 CPAP Cleaner and Sanitizer, which is an ozone-based cleaner, and these problems all clear up rather rapidly. You would do your patients a great service just by suggesting this one to them. And this brings me to the ticklish subject of dental unit water lines. By now you know it's a huge issue, as colony-forming units can be off the charts. Crazy to think that we mostly deal with microbe-based issues but use terribly contaminated water most of the time. Say you go to all the trouble to carefully dissect only the decay out of a tooth with air abrasion, use ozone and all the highly technical techniques a superb adhesion dentist would, including ozoning a prep, only to rinse off the acid etch with contaminated water. Or, say you didn't have a dedicated syringe for air only, so condensation or residual water in the line was present and incubating some pretty wild microbes. There is a great ozone-based solution to this, and I couldn't recommend it more highly. Today I'm pleased to introduce you to Dr. Tim Rainey. Tim was the dentist who introduced me to minimally invasive dentistry with an emphasis on air abrasion. He also taught me a lot about tooth anatomy that I certainly never learned in dental school, and I'm pretty sure you didn't either. So he's a biomimetic dentist as well, and he understands that one of the most important pieces of being a great adhesive dentist is to have clean air and clean water. So he's been working with that for about, decades, but he's finally found a system with which he's satisfied, and I'm going to let him take it from here.
Well, Carol, thank you very much for coming. Thank you very much for this interview, and let's see if we can get this word out about clean air and clean water to the rest of the world.
Thank you, Tim.
Okay, there's actually 3 different systems in this particular office that control the quality of the air that we live in and we breathe in and we work in every single day. First of all, we've eliminated incoming contaminants from the air compressor system. Number 2, we have eliminated the aerosols that are generated in the operatory. And then thirdly, we have contained the aerosols as best as we can, starting with the operatories and our 3 freestanding HEPA systems. We have one on both ends of the building. Catty corner, I have one in my back operatory and one here in the waiting room that greets our patients as they come in. These are running 24/7, by the way. And then we have our air handler system, which has a very large 5-inch HEPA filter in it. Also, it has the ultraviolet light system that helps generate ozone in any bacteria and particles that are coming through. That's how it destroys the bacteria that's pulled into the central air system. There's a number of different reasons why we're addressing all of the systems in this office. One, I'm starting with what's the benefit to the patient, what's the benefit to the dental professionals, what's the benefit to even the front desk person. If you'll think back and to the 1980s, when we first started recognizing the pathogenicity of CFUs, the thing that raised everybody's awareness was Legionella disease and the deaths that occurred in the members of the Foreign Legion there in Philadelphia. What had happened was they had a contaminated water tower that was cooling the air going into the building. There was a break in the system. They were actually pulling that mist into the system. Guess what? We do the same thing in our operatories. What is the importance of containing it in the operatory? One of the things that came out of that was there are systems that allowed us to look at antibodies. Legionella is a pretty weird bacteria in that you develop an immunity to it. It is not permanent. We can see what antibodies you have in your bloodstream, and you can watch these drop off. It will hit a threshold where you become susceptible to Legionella disease once again. And what they have found is in the dental offices, the front desk personnel have a titer that occurs twice the rate of the general population out there. Where is that coming from? It's coming from the aerosols that we create in our very own operatories. So there's the benefit. We start with shielding the patient from previous patient's saliva and the suckback phenomena that is very well established. We stop the aerosol from coming from the patient's mouth by using heavily ozonated water through our three-way syringe. How simple can that be? And then we keep reducing the aerosol by having the mini unit, the mini Biowell unit, constantly delivering ozonated water to the unit, and then we have the highly concentrated ozonated water, and we can switch back and forth between those. Welcome to one of the most advanced clean water systems in dentistry. What we're doing is we're generating ozonated water 24/7 here in this office. This unit generates the water on demand. This is the Biowell CDU unit. By just touching this button right here, we're getting at least 10 parts per million. We have actually measured it at 15 to 27 parts per million. And as most of you know, anything over 4 parts per million is considered therapeutic. This unit here is specifically to generate ozonated water and then send it into our dental units. So we use two different delivery systems within the dental unit. One of them is a water bottle that we fill up every single day and every single morning. We leave it there for about 2 hours, fill up again. We're going to have at least 10 parts per million of water at the unit available to spray into the patient's mouth. As you heard just a second ago, this unit constantly purges on a regular basis, so we have at least 3 to 4 parts per million of water available at our syringe, so that if we run out of the bottled water, then we can instantly switch and go to water that's generated from the Biowell Mini. There's a couple of things here that I would like to point out. We are still in hurricane recovery mode from Hurricane Harvey. We had so much damage to the ceilings and roof, we entirely gutted the entire building from one end to the other, which allowed us to update some of the systems in the office. We still haven't covered this up. This is very important when you put these systems in. Do not make the length of the line perfectly fitting the unit. Somewhere you want to have a looped line so that you can take more line out if you get a leak or something like that happens, or you need to work with this system. One of the things that we'd like to point out too is another use for the Biowell system that we think is equally important to anything else we're doing in the office, is that it is very, very effective to wash your hands with ozonated water right then and now. Your hands are cleaner than they would be if you'd used soap and a scrub. In order to have good, clean, ozonated water, you're going to start first with the incoming water into your Biowell system. And if you're running from a municipal water supply, then you must have less than 500 TDS, total dissolved solids, in that water. We prefer 200 because eventually you're going to clog up the filters in the built-in RO system in the Biowell. This little rural community, our water supply has in excess of 700 TDS. You can actually see the sediment in the water and put it in clear glass. So we start off with a very good high-end RO system. This was developed by GE over 2 decades ago, and you can buy it under a number of different names, from example bulk reef supply or filter direct. You can find them anywhere on the internet. Basically what you're looking for is a system with a booster pump one of the caveats is that you're going to have to change the booster pump switch so that you have at least 60 psi coming out of the system into your storage system. I also like in my systems, I like to have several different points where I can see what kind of pressure we're generating. This system right now, we've already used the water some this morning, and recently went through a purge on the Biowell mini system, and we're getting 50 psi. The Biowell systems are going to need approximately a minimum of 30 psi constant supply in order to generate the levels of ozonated water that we're looking for. We come out of this filter system with the pump, we go into a storage system. Because I'm supplying 2 of the Biowell systems, I just put in 2 of the 3-gallon tanks in tandem, and that's plenty to supply both of my Biowell systems in the office. Let's discuss the first important part of your dental operatory system, which is delivering clean air to the operatories. Very often we run into dentists who are very frustrated with their bonding procedures. They realize that something's amiss there. Now then, if we'll get them to take a cold mirror and just put air out of the 3-way syringe on that mirror, the first thing you notice is it doesn't matter whether or not you have a dry air system, you have contamination within that syringe. So we also recommend that you have a freestanding dry air syringe. Second thing is that when CRA did a study in the 1990s of dental offices, they found that the majority of the dental offices had highly contaminated air going into their operatories, and they weren't even aware of that. So think about how all contamination and moisture contamination can affect your bonding systems that everybody is now relying on for their dentistry. Let's talk about the contamination that occurs in these tanks. If you compress that air and raise it to 100 psi, the air coming out of your compressed air system is 220 degrees, and any type of moisture is in a very fine droplet system. It is atomized. Now then you take that and you immediately run it into a tank. Guess what? Now you have condensation, and you get from that a very highly contaminated tank system. If you run that out of your tank and then try to clean it up after the fact, it is very difficult to do. We want to clean up that air before it even gets to the tank. We want to run it through a radiator first. We want to run it through our filtration system. We want to run it through either a purge system or through a membrane dryer, so that we have perfectly dry air coming out of that system. Most of you dentists out there, most of the professionals are aware of scuba diving and how important it is to have a pristine air supply in those tanks. Okay, one of the things that can be fatal is having oil mist go into those tanks and ending up with that oil-related pneumonia. No bacteria, it just clogs up the lungs. The other thing is that if you keep putting moisture into those tanks from your system, guess what? Eventually that tank can and will blow up. That's very inconvenient whenever you're 100 feet below the surface. So we can generate very pristine, very clean air in our compressed air systems if we put the right sequence of filters in that particular system. And let's go take a look at the system. We're talking about what it takes to really put a great bonding system together for dentistry and a dental office. One of the first places and the least emphasized is the importance of a clean air, clean water system. And this here is the Texas Institute Clean Air and Clean Water System. We started with a commercial grade oilless compressor, so we have no oil going into the system, and these things are extremely dependable. They'll stay around for years. We have some of them that have been running for 20 years. We come out of the unit, and one of the things that people don't think about is you've got 220-degree compressed air coming out of your system. Most of the dental units make a couple of little loops, then put it off into a dental tank where everything immediately condenses out of there. Now you have a highly contaminated dental tank, and then wonder why the rest of your dental air systems in your office are highly contaminated. We go through a radiator first, and then we have a double filtration system where we have charcoal for bacteria, we have a coalescing filter, and then we have a very fine mesh antimicrobial filter, and we do it again, and then we put it down through a membrane dryer. You can use two different types of dryers: membrane dryer at the end of the clean air cycle, or you can use a purge dryer immediately out of the radiator, coming out of an all lubricated compressor, and then clean the air up, and then it goes by your tank. It doesn't go into the tank and come back out. The tank is just a pressure regulating device. Okay, so one point that's extremely important for people to understand, that is, if you're going to deliver ozonated water 24/7 to the dental unit, then your water lines must be exposed. We will eventually cover up these water lines with crown molding. We haven't gotten to that point, once again, because of Hurricane Harvey and the remodeling that we're actually doing in the office. Now then, there's two sources of ozonated water in this particular unit. One of them is the water bottle, which is controlled from this switch. That water bottle allows us to deliver to the patient over 10 parts per million of ozonated water, which gives a very thorough cleansing of the oral environment before we start any procedure, coming from the three-way syringe. Now then, the other switch is fed directly from our Biowell mini unit. It comes over the ceiling, down through the unit, into the back of the unit, and we control which source we want to use from this three-way switch right here. And we might add that this unit is part of the patent on the clean air, clean water system. It is FDA cleared, the only dental unit that is FDA cleared to market, and it is also patented. And the patents are in these switches and what it is that we can do with these switches. We also have another system in the office, and that is we have a vacuum system to pick up any materials that we're grinding, and then sandblasted material and so forth. We do that through our sink. We actually have a check valve on the bottom drain line, and before we get to that drain line, we tee off with a reverse P-trap, and then we hook it into a regular shop vac that we can control with a switch from inside the building. So if I'm grinding on acrylic, and this has been shown to cause COPD in some susceptible individuals, well, you can wait 20 years to find out if you're susceptible to acrylic and develop COPD, or you can eliminate the risk. Just have a good external vacuum system to pick up anything that you're grinding on in the office. Keeps your office clean, and it also protects the health of you, yourself, as well as your assistants and anybody else exposed to the debris from grinding on different appliances, particularly the acrylic.
Ozone is such a perfect part of the answer to most of the matters with which we deal day in and day out, either directly as we desensitize root surfaces, thoroughly clean out sockets, reverse decay processes, kill microbes involved in periodontal disease, and so on, or indirectly as it upregulates fibroblast activity, mitochondrial production, and so on. As I said, most dentists begin using it strictly for dental purposes, only to swiftly move on into other applications. If not for their patients, then for their families and themselves. Before we move on, it might be good to touch on ozone safety. These bullet points refer not to the mild uses dentists employ, but for a much more invasive but still extremely safe process called major autohemotherapy, or MAH. MAH is similar to an IV vitamin drip. Blood is first withdrawn from a vein into an IV bag, then medical ozone is infused into the bag. After the blood and ozone are mixed together in the bag, the mixture is dripped back into the vein. As a result, no ozone actually enters your bloodstream, rather a biological byproduct of the mix. Even with the far more unsafe way of direct injection of ozone into a vein, which is no longer approved, there are almost no complications compared to pharmaceutical drug reactions. Not only is this complication rate minuscule, but these were not major complications like death. Compare that to the fact that out of the 783,938 annual deaths one year from conventional medical mistakes, approximately 106,000 were due to pharmaceutical drugs, and I'm sure it's gotten worse since that particular year. That translates to 290 deaths a day, and I'm not taking into account opioid overdoses or any other overdose. This is strictly medical mistakes and complications arising from pharmaceutical drugs used as prescribed. Not only is ozone safe and effective, but it does not act as a drug. It works by stimulating intact biological systems, as you'll see in a moment. Okay, well, sometimes it acts like an antibiotic, only in that it's much, much more effective. First, it doesn't just act on bacteria, including those tricky spirochetes I talk about, but it works on parasites, viruses, and is particularly good at nailing fungi, all of which a person hosts orally, though dentistry seems to focus on bacteria. I think I've mentioned elsewhere that if you eradicate one particular niche like bacteria, pathogens love to fill in that niche like weeds in a vegetable garden. A lot of root surface fillings are fungi-bacterial combos. Let's talk specifics. Say you had 4,500 microbes and 4,500 molecules of chlorine. It would take 3,500 seconds, or just short of an hour, to nail them all. On the other hand, with one molecule of ozone, you could destroy all of them in about 1 second. So, it kills microbes at lower concentrations than chlorine and 3,500 times faster. And you know what's good about that? There isn't time for any asexual gene swapping or other morphs microbes use to become antibiotic resistant. And here's one of those outside dental uses I like in particular. Ozone oxidizes phenolic methanol benzene compounds, detergents, pesticides, and other chemical manufacturing wastes without chlorine's trihalomethanes and other harmful residues. That means when produce comes home, it goes into a silicone bag and gets a quick ozone treatment. None of that E. coli on greens or fake watered-down organic standards for me and the people I care about. But I'm sticking to my guns when I say its primary use is to modulate dysfunction on multiple biological levels. For instance, ozone significantly affects the structure and functional features of mitochondria compared to just air or even oxygen-treated samples. A concentration of 10-gamma increased RNA transcription and microbial activation in a study. In dose-dependent ways, it increases the negative charges of cell membranes, and it activates some gene expression. You can see in transmission electron micrographs, such as the one that's here, that mitochondria treated with 10-gamma, or another way to say that is 10 micrograms of ozone per milliliter. In cells treated with that, the mitochondria are large and have well-developed cristae. An inability to use oxygen well is one of the cornerstones of the aging process. Ozone plays a strong role in the body's ability to reverse that. Increasing oxygen utilization increases ATP production as much as 40%. It increases alveolar oxygen pressure to venous oxygen pressure ratios. It enhances red blood cell membrane distensibility, increases cytokine production, increases antioxidant buffering capacity as well, and then it also increases oxyhemoglobin dissociation. Ozonated water has many uses in dentistry. These kinds of things are included in ozone courses. Again, I recommend the ones by Drs. Bob Harris and Phil Mollica. There's only one mild ozone caveat, but I mention it in the interest of thoroughness. Some people, and they're almost exclusively males of Mediterranean, African, or Asian descent, have the glucose 6-phosphate dehydrogenase enzyme deficiency, better known as the G6PD enzyme deficiency, and they can't do ozone except in minuscule amounts. Only about 400 million people worldwide have it. This condition mainly affects red blood cells, which causes them to break down prematurely. Hemolytic anemia is the most common symptom. These people will have pale, yellow skin, and the whites of their eyes will also be yellow. They may also exhibit with dark urine, fatigue, shortness of breath, and a rapid heart rate. People with this deficiency can be treated with ozone in minuscule doses, as I said, and in fact, this may actually upregulate G6PD enzyme activity. But, of course, you'll probably never run into it. Ozone-trained dental practitioners, among other problems, treat denture sores, yeast infections, cavitations, TMJ pain, and root sensitivity. Practitioners use ozone to inactivate the bacteria, spores, fungi, and parasites involved in gum disease. It changes oral ecology and pH, plus it activates fibroblasts, one of my favorite uses. Ozone changes the optical qualities of bracket scars, making them less noticeable. If a patient insists on an implant, ozone application to a site beforehand advances healing by several months. Ozone may also be one of the best ways to sterilize a dead tooth with its miles of tubules, though biological dentists think even ozone-treated teeth go back to incubating health-challenging microbes within a few months. The decay in this tooth just about invades the pulp, tipping its ability to keep the tooth alive and nourished. Interestingly, ozone does not damage a tooth's nerve. It actually switches on repair mechanisms. Treating with ozone gas after air abrading settles the pulp, kills microbes within the tubules, and neutralizes and deactivates their toxins. This in turn offers a 15 to 18 week opportunity if a person eats correctly, that is to say an alkalizing diet, so that minerals can reprecipitate into the tooth coming mainly from the pulp, to remineralize and protect it. This is what I'm talking about when I say remineralizing from the inside out. That is how a troubled tooth can go from looking like this to this within 3 months. Immediately after air abrading and ozone application, a previously decayed area looks dull and leathery. But several months later, it will look shiny and hard, indicating that it's been remineralized. The mind-boggling implications of this process is that it's no longer necessary for a dentist to remove all decayed tooth structure, especially as it nears the pulp. You would remove just enough to take it to this leathery layer and then stop, so that a maximum amount of tooth remains to provide precious structure through remineralization. That doesn't mean you can't opt to fill it in, preferably using biomimetic techniques as I present in the next video. It's just that you don't have to. As far as redecay is concerned in these areas are now just about bulletproof for life. Just take a little bit of this out on a plate with a toothpick is what I do, and then just kind of work it down in there the best way that I can. Your tissue's gotten so healthy actually but you can see that you can kind of work it down in there and kind of work it in from both sides.
Okay.
And then your other places that you're going to do it, you don't have to do this now for another little while, but you're going to come from the outside here and kind of put it down into that furcation where the roots divide. Right there, and then just kind of in between these guys.
Oh, okay.
Can you feel how that's kind of tipping forward and then backwards? You're going under that gum and then just down in here. You're just trying to work that down there as deeply as you can. So what it is in the back, you're trying to go to either side of that tissue, and that's all there is to it. You don't have to be very wide open. It's fine. All of this was designed to tickle your interest. Of course, this isn't a course to train you in ozone use, just to help you see some of the many reasons why you should take the plunge if you haven't yet. Do you remember when I told you my first introduction to cold lasers and I thought it was a little bit airy-fairy with its blinking pink and blue lights? Well, a few years later, one of my employers bought one for home use, and because he just wasn't all that comfortable with knowing how to use it optimally, he requested the distributor to come and give us a training session during lunch. It was a great presentation, but sometimes seeing is believing. Or let's make that feeling is believing. Not surprisingly, I had a knot the size of a walnut right here in my upper back since I was in my 20s, probably from the constant odd position we dental people have to assume. I'd had all kinds of body workers try to resolve it, but it just never went away. So at the end of the session, I thought I'd try it out. I asked him if he would apply it to the spot, and of course he did. I was shocked because within seconds, tingling started at the epicenter, if you will, and quickly expanded out and away from the center, and poof! The knot released and it never returned. So at that point, I was pretty sold on the idea of energy medicine. Several years later, as I ventured into ozone therapy and took Phil Malika and Robert Harris's courses on it, they were injecting ozone into areas just like that with much the same results. So of course I immediately made the connection between sufficient electrons and many healing modalities. These are very powerful tools for your patients, but I suspect you are starting also to see the potential for you and your staff. Next up, an interview I had with Dr. Mercola in 2012. If you want to learn more about how I talk to clients about ozone or hear about how we talked about preconditioning and so on, stay tuned for another 20 minutes. I hope you've enjoyed learning about one of the most revolutionary fields in dentistry. I'll see you next time.
So another component of this type of dentistry that you mentioned, this minimally invasive dentistry, is the use of ozone. So I'm wondering if you could describe how one integrates that into this approach.
Oh, I can't believe I didn't hear of ozone until about a year and a half ago, but it's wonderful.
Well, you've heard of it, but you're referring to the application of ozone in dentistry.
In dentistry, yes.
Because what most of us hear about it, we're concerned about it's a dangerous toxin. When ozone levels go high, we're going to get sick. And
so let's talk about that first, because that's really important.
Yes.
Ozone is actually up there to protect us, right? That's the important part of it. When they say ozone action days, what they're talking about is that there's a lot of pollution in the air. Ozone's purpose, or one of the, it's helpful. It combines with the pollutants to let them precipitate down to the ground. So it gets it out of the atmosphere so you're not breathing it.
It's the way nature cleans up the air.
It's the way nature cleans air. So when they say Ozone Action Day, it's just that they're talking about there's a lot of ozone out there because a lot of these components need to be brought out. So it's a measure of pollution. But yes, people hear ozone and
they think
it's the ozone itself that's toxic.
When actually it's a reaction to the pollutants that are in the environment.
But I may also say here that ozone gas, all by itself, should not be breathed. I mean,
at
you
least
know,
in
there
high
are
concentrations.
Yes,
Because
well,
it's directly toxic to lung tissue.
To lung tissue and to eye tissue, and we are using it close to the mouth. So there are precautions that you have to. I mean, you have to take a course in it. You can't just start using it. But since we deal with microbes in the mouth, I can't imagine a better place for ozone. I use it all the time in gum disease, and we can talk about that. But right now we're talking about tooth structure, and let's go back to that third way that cavities form in the mouth. A lot of times plaque just sits at the gum line, and you know, people routinely miss plaque at the same place all the time. It's in the pits, it's in between the teeth, and it's right at the gum line. So when you see a white spot on your tooth, or the dentist points it out, that is a decalcified area. Enamel is like a mineral bank. You can lose minerals because plaque is sucking them out from the acids they produce. But the saliva is there with plenty of minerals to reinstitute it back into the tooth, and it's supposed to be a balance.
Mm-hmm.
So ideally you won't have a lot of plaque sitting there. But be that as it may, once you have those white spots, those decalcified areas, you know, the powers that be would have you think that fluoride goes in there and strengthens those, which it does.
That's a conventional thought. Yes.
It is the conventional thought. But you've lost the crystalline structure. Once you've lost the crystalline structure, it's never going to recrystallize again. It's amorphous, so acids seep through. So once you get to that next layer of tooth called the dentin, it spreads out and the decay just becomes a chemical process. So if acids can still seep into the tooth, and it's decaying from the inside, you've got to be able to get to that to stop it. Ozone is the only way to predictably remineralize a tooth.
Will actually remineralize it.
It will.
Didn't
Well,
realize
it doesn't, it's a component of the process, because what it's going to do, as a gas, it diffuses into the tooth. So through those little white spots, into the tooth. And it can go up to 5, I've heard anywhere from 2 to 5 millimeters, let's just say. So that's significant when you're talking about the size of a tooth. So the first thing it does, it's going to kill all the microbes in the tooth, and that's important.
Yeah, that's well documented. It's a very potent antibacterial.
Yes. And in gas form, that's the only way it will diffuse in, because a lot of people will try to use the ozonated oils, and there's no diffusion that way. But even more importantly is that it denatures their end products. The end product of bacteria are acids. And so it changes the chemistry of the tooth from acid to neutral, so that now the tooth can remineralize the way it's supposed
changes
to.
the pH, the environment.
So, and a lot of people think that remineralizing happens from the outside in, but most of that remineralization is actually going to be coming through the pulp. So the pulp, of course, is that hollow internal structure of a tooth that is filled with blood vessels and nerves and is designed to give the tooth nutrients, keep it hydrated. And so the minerals are going to come in through the pulp and feed out this way and bring the minerals to that area and harden it.
Will we mineralize in the right type of matrix and crystalline form, so that actually provides the function back? Oh, perfect.
Yeah, it's a wonderful thing.
And once it's remineralized, then it's less likely to be damaged again.
Yes.
So it's this way of actually treating the potential decay.
Another beautiful thing is when a person has rampant decay, maybe even gum disease, you can make, there are a lot of young children who, when their brace is removed, they weren't so good at their home care and they have all these white spots. We can make trays that completely seal off the whole arch. There's an input of ozone and an export with suction, and we just put it on for 10 minutes every 3 months.
Okay, that was the next question, is what is the frequency? Is at some point do you reach a plateau where ozone treatment's not required anymore?
Oh, sure. There are lots of reasons to use these ozone trays. You know, they would only probably need it 2 or 3 times, I would say. When I say every 3 months, I'm talking about people, I switch subjects a little bit. There are a lot of people who have zero saliva in their mouth, so their pH is always really low, very acidic. They're not providing the minerals to their tooth. They're half the time that they don't have saliva is because any of the 500 to 700 drugs that cause, you know, salivary flow to stop, and they're highly, highly prone to decay. And so we know if they're on these drugs, they have other systemic issues as well. So that's where these trays are so wonderful, because they can pretty much stop the whole cavity cascade that happens in them.
So I'm wondering, for myself or others, if ozone might be a way to sort of get a hold on that, these intermittent ozone treatments to get the dental plaque under control, or is that just something more that's typically used for remineralizing the tooth?
I think that's really interesting, because most people with as clean a diet as I know you have are not plaque builders. So well, I'm getting ready to have braces, and one of the things that I did not want to ever do that for was because, do I really want to floss in braces? Not really, but you know, I am a hygienist and I'm older, and so what I'll be doing is getting some ozonated oil. So that's simply like olive oil or jojoba oil, something that through which ozone has been bubbled. And then my favorite tool might be the Butler Soft Picks, I think they're called. It's just a little tool that I can dip in the oil and put in between my teeth. You can put it anywhere there's plaque. It pretty much melts the plaque off. So
really?
plaque is the
Interesting.
Plaque is the soft precursor of tartar.
How would you integrate the ozonated oil into that?
Anytime during the day, you know, that you want to.
It doesn't necessarily need to be done at the time of brushing?
Well, if you're, no.
Okay.
I mean, that is what you're brushing with. I mean.
Oh, you're brushing with the ozonated oil?
You can do whatever you want with it. You know, it depends on where your plaque is and what your objective is. It's too expensive for me to brush with it. It can last for months and months if all you're trying to do is get in between the teeth and you're just picking up a little bit with a little pick and putting it in between, and that's where most people miss.
Okay. But you could brush with it?
People could. Now, here's a caveat. It doesn't taste good. It tastes a little bit like rancid oil. So
okay.
I don't mind it. It's
because it probably is.
Yes.
Well, and let me just expand on that, because these oils, they have fats in there, and they're susceptible to oxidation, and if you're going to put ozone in it, it's exactly what it's going to do.
That's what you're doing.
So that's probably why you'd want an oil that doesn't have a lot of double bonds. You wouldn't use something.
Actually, you know, the more double bonds you have in it, the more ozone it's going to pick up.
Interesting.
I mean, the whole point. So there are a few people out there who are trying to ozonate coconut oil. Well, it's only 3%.
It's saturated fat.
Yeah, so it's not going to pick up any.
Interesting. So, because there are a lot of machines, and I'm in the process of probably picking it up myself, that can produce ozone in your home, and you can create this ozonated oil yourself.
Yes, and here I want to say a caveat also. Malika and Harris is where I learned all my ozone therapy and dentistry. They are teaching all the uses of ozone as far as dentistry is concerned, and it's fascinating, but the important part is the machine. Because it is such a powerful oxidizer, you're generating it. You've got to generate it from medical grade oxygen, right? You don't. If you're trying to generate ozone from ambient air has 70% nitrogen, and you're going to make all kinds of toxic materials. So you want to use medical grade oxygen, and
So
then the whole
tank.
machine.
It's a gas
You need
cylinder.
a tank, yeah. But you also need a machine that is completely hardened. You know, you have to either, you know, the hoses have to not be able to be oxidized as it passes through. A lot of these cheaper machines, you're going to end up with various toxins that aren't necessary. So while those cheaper machines may be useful for gum disease therapy and for using in the tooth, the way I've just talked about, you can't use the more elegant solutions. If I had one of the more expensive machines, everybody that had gum disease that I was working on would also probably be breathing ozonated oil through their nostrils, as long as I was bubbling it through.
They would breathe the oil through the
Oh,
nostrils?
I'm sorry, I said that incorrectly. They would be breathing ozone that has been bubbled through oil.
Okay.
That makes compounds that are quite acceptable to the lungs. Because one of the things that we have going on.
So when you bubble the ozone through the oil, which you actually produce ozonated oil that you can use, you actually produce you filter it in some way that makes
It's
it
a filter
less
that makes
toxic
it
to the lungs.
not less toxic, it's actually beneficial.
Interesting.
Isn't that wild?
I've never heard that before.
Ozone has amazing abilities in the body.
Oh, sure. And some people, Dr. Robert Rowan is one of the major advocates of that and teaches it. And he's told me many times that it's, in his view, one of the best anti-aging approaches is ozone. Somewhat similar to exercise, because exercise by itself is an approach that will break down the body, but we know that's exactly what you need to make your body stronger, because you know it's the same principle.
It acts on so many levels. If you get me talking about it, I'll tell you all of them. So, no. But one of the things that we have a difficulty with is that as we clean teeth or as we blow a horn or whatever it is, quite often we aspirate oral bacteria into the lungs. So the same thing. People with chronic obstructive pulmonary disease, you have to take a lot of precautions when you're cleaning their teeth, and what a wonderful thing would be for them to be breathing the ozone.
Interesting. So it's interesting you mentioned, I mean, you really lit up quite a bit when you talked about ozone. So maybe just mention some of the highlights and why you're so enthusiastic and passionate about ozone therapeutically.
Well, perhaps I should start from the dental perspective. You know,
Yeah.
we've already talked about what it can do for teeth, and by the way, there are many other dental uses for it. It changes the optical quality, by the way, of those little white spots on the teeth that are so aesthetically unpleasing to a lot of people. It can be used for people who have herpetic lesions. So these little cold
Interesting.
sores and things like that, you can either put the gas on it, or and some doctors will inject underneath that, because and 65% of the time those never return. So that's a lovely thing.
Wow, that's a novel treatment I've never heard of. for that.
It's wonderful. There's a problem with people who have taken the bisphosphonates, like
Did you know?
Fosamax, Boniva, you name it, and they get these areas of dead bone in their mouth. It's a huge problem.
Osteonecrosis.
Osteonecrosis.
Yeah, it's a major risk factor that I think hardly any physicians who prescribe these dangerous drugs, which should never be used, in my belief should be absolutely banned from the market, that they even warn people about.
No, they don't. I mean, they're trying to kill bone to save it. Somehow that doesn't make sense. But you can treat these lesions with ozone in various ways. A lot of the doctors will inject up under it. They'll use ozonated oils. You know, they're very, again, you have to be
Will
trained in
ozone
it, but
actually help catalyze the reversal of this process, or once the bone?
it will heal it.
Oh my gosh!
Yeah, and
I
it'll
didn't
heal
know
it
that.
rather rapidly.
I didn't know that was a solution for that.
Isn't that
God,
astounding?
That is astounding.
Yeah.
And I don't think it's widely known at all.
No, it isn't. So I've been gifted with this information. I'm
Yeah.
telling you, these guys are amazing. The whole point of our red blood cells is to carry oxygen. What if you could make super gifted red blood cells that could carry much more oxygen? So when you have a treatment, it can carry, you know, your red blood cells that you have now, plus the ones that you make 3 months on into the future, will all be super gifted. You'll be carrying more oxygen. The energy generators in a cell are called mitochondria, and in many cells you're only producing 2 units of energy for each mitochondria, and it can increase them up to 36 units of energy. So
Wow.
you can really crank your energy levels up by
That
using
actually
it.
interesting. I didn't realize that. That may be one of the reasons why it works on an anti-aging process, because there's a number of theories on aging, and one of them certainly involves the progressive decline of the function of the mitochondria.
And you make more mitochondria, you know, so that's pretty neat. And everybody's on the antioxidant bandwagon, and that's a wonderful thing, because, and here's kind of the interesting thing
Well,
about
that's the whole
ozone.
issue, because ozone supposedly is an oxidant, so you take an, you know, an antioxidants are good, so ozone must be bad, and that's where the confusion lies.
There is some confusion, but there's something that happens that's called preconditioning. Believe it or not, your white blood cells make ozone. That's one of the primary ways that they work. They also, when you use
Is it ozone, or is it peroxide, or is it both? I thought it was peroxide they use.
I think it does make. I think
Ozone.
it does make ozone. Scripps
Okay.
Institute.
Okay.
I'll have to go back and look at the studies, but they showed 2 different.
Because peroxide is a form of ozone,
form.
which is why I like to use it so much. It's one of my favorite over-the-counter tools is
Yeah.
peroxide. It's great
It's
for teeth.
weaker, but yes, yeah, it's great for so many things. So, but it creates the white blood cells. Then are able to make a lot of the antioxidant enzymes that we need. So they become super gifted as well. So they help the antioxidants recycle, if you will. And that's another wonderful use of ozone. So, and another thing, a lot of people in dentistry have TMJ joint problems. Like me, they have a forward head posture, and that means that all of these muscles are always going to be in pain. Ozone adds electrons to the system, so some doctors will actually inject ozone into the muscles, and that just melts away. It's not unlike using a soft laser to deliver those electrons to an area. And I've had both used, and it's just astounding. Muscles that have been tight for 40 years are no longer tight. And
That's terrific.
It's a lovely thing.
Yeah. So it seems like you've been able to accumulate a whole load of tips on how to improve health from a dental perspective. And I wonder if there's any other tips that you've accumulated that you'd like to share.
Well, just a second ago I couldn't think of, okay, how I use ozone in dentistry. I forgot to go into that.
Sure.
I would never think about picking up a probe or an instrument without having ozonated oil on it, because in the pocket it's going to kill all the microbes in the pocket before I begin to manipulate those tissues, so I don't create that bacterial shower into the bloodstream.
So you just dip the instrument into the oil and you put it back in there?
Yeah, I always on my tray have a little pool of it. And I do that. It oxygenates the pocket. So almost always infected tissues are going to be acidic, so it'll make them more alkaline. The nice thing for me is that the tartar, the hard deposits, it seems to break the bond off so much easier. It's just a lot easier to pull that off, so the patient is happier.
It's also, as you said earlier, it's a preventative to remove the plaque.
Yeah, the plaque
So
is
that makes
also,
sense.
so again, the germs are dead, but the tartar also, the harder deposits are easier for me to do, so I have to do less manipulation of the tissues. It's wonderful.
I mean, significant, because that's an occupational hazard for trigenists, the carpal tunnel from doing
We get
that.
so, yeah, we get so sore here. That's exactly right. The patients like it because it slows down nerve transmission. That's a wonderful thing. In fact, we use ozone quite a lot on these exposed roots to stop the sensitivity. So they don't necessarily feel the scaling and root planing like they otherwise would. A lot of times the trouble with gum disease is that the germs have invaded the walls of the pocket, and we used to do a process a long time ago called a curettage, and we would just kind of remove that tissue from there, but it required anesthetic, it was uncomfortable, it wasn't a very smooth thing. Well, the ozone just kind of dissolves those walls off and the patient never feels it. And the whole goal of periotherapy, or gum disease therapy, is to get the tissues to reattach to the tooth so you won't have pockets. It does this, I call it kind of a Velcro-like closure. It does this with what we call fibroblasts, and the more fibroblasts you have, the more likely you're going to have tissue reattachment. So with all the healing and the fact that it really stimulates fibroblasts, you're going to have a much better attachment. So I've had very, very deep pockets reattach.